A very good morning. We're glad you're still with us. Let's now take note of easing healthcare through self-testing. Did you hear that right? Easing healthcare through self-testing. I'll be introducing the guest who will be helping us understand what is going on and how best we can use self-testing to be able to ensure that our own health is good. But let me just give you a preamble. Given its potential to advance health equity and speed towards universal health coverage, self-testing can transform healthcare. The options offer individuals and communities easy, fast and confidential pathways to diagnosis and care for a growing number of diseases, for example, HIV, hepatitis C, but the emergence of more accessible and affordable self-tests coupled with a growing self-care movement provides greater opportunities for people to direct their own disease screening and make decisions based on their results safely, effectively, in a confidential and convenient way. Emmanuel Lubandi is the Sales and Marketing Manager at Human Diagnostics Uganda and is going to help us understand where we are in terms of the movement for self-care but also self-testing. Welcome to the program.
Thank you.
How are you doing?
I'm okay. Good morning, viewers.
Great. When I hear self-care, it takes me back to what I've had for a long time now, especially within the movement that is directed towards ending the spectre of HIV/AIDS.
Yes.
When it comes to self-testing, confidence but also trust in the system is very key.
Yes.
I know those are considerations that those that provide these self-care kits have thought about and rectified. Just take us through what Human Diagnostics Uganda is all about and exactly what your role is in the self-care movement.
Yes. Human Diagnostics Uganda is a company, and we deal in medical testing equipment and devices. And we've been in operation for quite a good number of years, and we brought on board a number of testing devices that have helped in healthcare, both in a hospital setting, and right now we are talking about self-care. So, HIV has been with us, commonly known as slim disease in the 1980s there, and it caused a lot of chaos within our country. And of course, up to now, we're still grappling and we are trying to fight and see how best can we achieve the targets.
That's right.
Yes, the government, through the leadership of the President, the Minister of Health and the different partners have been proactive on this to try and see that we achieve the 2030 goal of ending HIV in Uganda. So HIV testing is very important in this regard because having an informed approach to health is key. So Oral Quick is what we are talking about today.
That is the self-test kit?
Yes.
Okay.
So Oral Quick is a self-test kit that you can use to test yourself and your pattern before engaging in any activity. This week we read a story about the challenges with delivering drugs in the different parts of the country, especially the islands and the other areas. Before even we get the level of testing of drugs, can we first test? Can we prevent ourselves from contracting the disease?
The disease, yeah.
Yes. So because we've had a number of reasons why we don't test. One of them is access, going to the hospital.
Yeah.
Government hospitals, maybe they are crowded, they have a lot of people. So Oral Quick comes in to bridge that gap of testing, where you can do your test from anywhere, at home, in the car, anywhere that you be. Because if you expose yourself to the disease, then the chances of dropping to the treatment, which is not a cure, but a lifelong treatment.
Lifelong treatment, yeah.
Is really not an option.
Allow me just interject, halt you in your tracks there, and bring to the fore an issue that an average Ugandan could be grappling with there. When doing the self-testing,
Yes.
issues of effective result delivery come in.
Yes.
The nature of transmission of HIV or any other disease is down to a period.
Yes.
And there are chances that the technology embedded in the self-test kit could skip the time frame. Okay? In other words, you could get the result when actually it is not true, on account of the fact that the incubation period for a disease or a virus is still well below where it is detectable. How does that get addressed?
Yes. Just like any other testing device for HIV, even the kits we use in the hospital, the way it is used is the first step. So, especially for this oral quick test kit, we tell the procedure is you test at least 30 minutes after you've eaten something. So if you've been eating, you should put a gap of 30 minutes before you test. A lot of times people say this is a lot of time, but it's not a lot, especially if the decision of the result prevents you from getting HIV that you treat for the rest of your life.
That's right.
So 30 minutes is very small, and the test takes 20 minutes. So the accuracy of these kits is primarily dependent on the usage, first of all. Someone should use the kit the right way. Yeah. So the 30 minutes is really very small time, and within 20 minutes after taking the test, you have the results. So if someone really can be patient, then we can help each other. So about the authenticity and the accuracy of that kit and detection, these are kits which have been approved by WHO and then also adopted by the Ministry of Health of Uganda. So they are being used even in the hospitals, the public hospitals, and all the testing sites across the country. So the accuracy of the results that is delivered by these test kits is not doubtable. But when you test the first time, because the status of HIV can change. So if you tested it today, that does not give you a lifelong status that you'll be negative for the rest of your life.
That's right.
So it's possible to test today.
Excuse me.
You test later, and again you're sick. So because this is something that you can contract because of your conduct as we move on. So it does not mean if I test today, then I test after some time and I'm positive that the first test was wrong. Not entirely. So the status of HIV, unlike other things, for it can change. So it is dependent on the way we conduct ourselves.
Okay.
Yes.
Just allow me broaden this beyond the self-test kit and pick your mind on the self-care movement. Cost is important. Accessibility is key. But we have communities and people that are constrained financially. Others are simply illiterate. And that could hamper their ability to be good when it comes to self-care. Is there any concerted effort to help those who are vulnerable in that stead?
Yes, about accessibility of these test kits. Of course, we are all not at the equal measure. There are those who can afford to purchase these kits. Then there are those who may not be in position because of the cost that is associated with the test kit.
And yet the centers are already again?
Yes. So now, for the people who can't afford these test kits on their own, I will assure you and I will tell you this, these kits are readily available for free in all public facilities.
All right.
So if you walked today here where we are in Kampala, if you walked to Bugolobi here in Kiswa Health Center 3, if you walked to Naguru Hospital, if you walked to Chisenyi and all these other facilities, they can. These kits are readily available, and all you have to do is ask for a self-test kit, and they will give it to you for free.
For free.
So they will give you that test kit, and you can walk with it home and you test yourself. They don't force you to do the test within the hospital. That's why it is called self-test. So they will give you the kit, they will just document, and then you can walk away with your kit. So you can take your kit and for your partner as well, and so that you can test yourself. So because this is the whole idea.
Yeah.
People should be able to test for HIV on their own, so that they make informed decisions.
Now, the messaging is very important, and as you're a marketing manager, that means you're pretty abreast with the dynamics of communication and perception.
Yes.
Some people imagine that if they've tested and the self-test kit has given them a negative results, they might assume that it's about time to engage in unprotected intercourse. Isn't it significant to communicate that even when you have used the self-test kit and the results are negative, you should not engage in unprotected sex until you are sufficiently confident that you two are actually negative? Then that should be the messaging.
Yeah.
I'm not trying to downplay the fact that the self-kit is there, but isn't there a need to drum that a little bit more?
Yeah, sure. Excuse me. The testing alone is not enough. And we are not saying that as soon as you test someone the first time and they are negative, you're good to go.
Trust a Ugandan.
But
they'll be like, yeah, there we go.
But mind you, even without this self-testing, there are people who are still going without.
That is irresponsible.
Yeah, but so why we are having the self-test is because we have there are professional kits in the hospital, and oftentimes they are being used, I would say abused by people, because they are not self-test kits. They are professional kits. So someone is visiting to prick themselves to try and take a sample, then they don't have everything that is needed to use that kit, so they are using water, they are using so many things to try and do this test. So even without self-test kit, people have been attempting to do these tests. Yeah. Okay. Yes, so the self-test is coming in a way that everything is packed with this kit, so you can safely do the test the right way. But we are not saying go ahead and, because there are more other things, there are more other diseases away from HIV. Okay. There are other STDs and all that. So we can, this one is only testing only HIV, but there are other conditions that you may contract if you go recklessly in this.
All right, yes. Your last word, wrap this up for us.
HIV is with us, and it is within our hands to protect ourselves from contracting it. Self-care is very key now, and there's a lot at stake, because the population, the young population especially, that has been contracting HIV in the previous 1-2 years, especially during the COVID period, the number is increasing. So we can only be safe if we test.
All right, Emmanuel Lubandi, Sales and Marketing Manager at Human Diagnostics Uganda. Many thanks for the perspective on self-care movement and the growing use of self-test kits in the fight against diseases, including HIV/AIDS and hepatitis. Now it's coming to the top of the hour, and let me now switch to Luwero, where the Episcopal consecration and installation of Monsignor Lawrence Mukasa as the third bishop of Kasana Amase Luwero Diocese is being prepared. We are going to be speaking to Monsignor Francis Xavier Mpanga, the Kasana Luwero Diocesan Administrator, on those preparations. Let's now join our colleague Herbert Kamoga for that interview.